Assalamu alaikum. My name is Mahnoor. My roll number is 26 and my topic of presentation is painkillers. In this presentation, I will discuss what is pain, types of pain, different phases of pain perception, what are painkillers, working of painkillers, different types of painkillers such as Nsaids, Paracetamol, Opioids, mechanism of action of these painkillers, migraine and painkillers used for it, arthritis and different kinds of painkiller that can be used for it, which type of painkiller should be prescribed and side effect of these painkillers. To understand the painkillers, we first need to know about the pain, that what is pain. Pain is also called algesia. It is an unpleasant sensory or emotional experience that is linked with the actual or potential tissue damage. In other words, we can say that it is a localized, unpleasant body sensation or complex sensation that can cause mild to severe discomfort and emotional distress. And the pain typically results from the body disorders. So, to treat pain, different sorts of painkillers are used. Painkillers are also commonly called analgesic or pain reliever. These are the groups of drugs that can be used to achieve relief from pain. Painkillers can be taken in different forms, such as in the form of liquid tablets or capsule by mouth. We can also take painkillers in the form of injection. The example is corticosteroids, which are administered in the form of injection at the site of musculoskeletal injuries. Painkillers can also be taken via back passage or rectum in the form of suppositories. Example of such painkillers are paracetamol or oxycodone. Some painkillers are available in market as the cream, ointment or patches. Example are menthol, methyl salicylate, which are used to treat the minor pains of muscle and joints. Pain is a very important defense mechanism. It warns the body about the potential or actual disease or injuries. It is a symptom, not the cause of problem, and protect the body from the damage. It signals the body to take the protective action against the pain. So the noxious signals send the impulse to the spinal cord, which send the information to the brain. Brain interprets this information, localize the pain, and send the instruction for the body to react. These pain sensations are mediated by the specific types of receptor, which are called pain receptors or nociceptors. Nociceptors are present in skin, tissues, and all the organs of body except brain. Nociceptors are the nerve ending of first order neuron in the pain pathway. The axons of these receptors can be either myelinated or unmyelinated. When the axons of these neurons are myelinated, they are called type A, and when the axons are unmyelinated, they are called type C. Type A myelinated axons, these are the fibers that conduct the impulse at very fast speed and are responsible for the initial sharp pain at the time of injuries. Whereas unmyelinated type C fibers conduct the impulses at very lower speed and are responsible for the long-lasting diffusing pain. So the pathway for the transmission of pain signal to the brain is first order neuron will travel to the spinal nerve. And synapse with the second order neuron in the dorsal horn. These second order neurons then cross over to the other side of cord before ascending to the brain, and this is how information of pain on the left side of body is transmitted to the right side of brain. In the same way, the information of pain on the right side of body can also be transmitted to left side of brain. So there are two different pathways that carry the signals from the spinal cord to brain. First one is spinothalamic tract, which involves the localization of pain, and the second part is the spinoreticulator tract, which is responsible for the emotional aspect of pain. Types of pain. There are two major types of pain depending upon the source from which it arises. Pain that arise from the skin, muscles, or joints are called somatic pains. Whereas the other form of pain, which is visceral pain, it comes from the internal organ of the body. Visceral pains are also perceived at different locations by the phenomena which is called referred pain. Example of referred pain are the pain from heart attack, which is felt in the left shoulder, arm, or back rather than the chest, where the heart is actually located. The reason for it is the convergence of pain pathway at the spinal cord level. Spinal receptors are present in spinal cord from T1 to T5, and these receptors will receive the pain signals from the heart as well as shoulder. As a result, the brain can't tell apart because the superficial tissues have more pain receptors and are more often injured, so it is common for brain to make the assumption that pain might have come from the shoulder rather than the heart. Phases of pain perception. There are different phases of pain perception. There are major five phases. First one is the transduction. It occurs when the stimulus such as pressure, thermal energy, or chemical irritation is converted into the nerve signal or action potential. Transduction occurs when there is release of chemical mediators such as prostaglandin, serotonin, or histamine. The second stage of pain perception is the conduction. After the noxious stimulus, conduction of action potential will occur. In third stage, the transmission will occur, which involves the conduction of action potential from the site of injury to the spinal cord and then transmit the impulses to the brainstem, thalamus, and the cerebral cortex. Fourth stage is perception, in which the patient have a conscious experience of pain. Now we can say that awareness of pain arises. The fifth and last stage of pain perception is the modulation. It involves the signal from brain that are going back down the spinal cord to modify the incoming impulses. Working of painkillers. As we know that our body contains the nerve ending which have nociceptive fibers. These fibers send the signals toward the brain and indicate that pain is arising in the certain part of our body. Whenever our body part is damaged or in the case of injury, a specific chemical which is known as prostaglandin is released. Nerve fibers are very sensitive to the prostaglandin chemicals, and when the fiber detect these chemicals in our body, they will send the signal such as sign of inflammation and pain towards the brain. Painkillers work by blocking the prostaglandin because these are the chemicals that detect the pain. When painkillers are taken, prostaglandin will be no longer released and brain will not feel the pain. Pain is the symptom, not the cause of disease, and protect the body from the damage. So whenever we aid the painkiller, it will block the prostaglandin and ultimately blocking the signals of pain. As a result, brain cannot feel where the pain is occurring. It does not mean that we are solving the problem. The main problem is to reduce the cause of pain. Types of painkiller. There are different types of painkiller that are taken to achieve the relief from pain. Three major types of painkiller are Nsaids, paracetamol, and opioids. First, we will discuss the Nsaids, which are also known as non-steroidal anti-inflammatory drug. These are the medicines that are used to relieve pain, reduce inflammation, and bring down the high temperature. These are commonly used for the headache, arthritis, strain and strains, and some other cause of long-term pain. The common examples of NSAIDs are ibuprofen, diclofenac, and naproxen. These medicines are mostly prescribed for treating the conditions such as arthritis. Most people are familiar with the over-the-counter non-prescription NSAIDs such as aspirin and ibuprofen. NSAIDs are more than just the pain reliever. They help to reduce the inflammation and lower the fever. They prevent the blood from clotting, which is good in some cases but do not prove to be beneficial in other cases. Because these painkillers reduce the clotting action, some NSAID, especially aspirin, may have protective effect against the heart diseases. There is a vast variety of NSAIDs which are classified into different groups depending upon their chemical structure and selectivity. For example, acylated salicylates which are available in market in the form of aspirin, non-acylated salicylate, propionic acid, acetic acid, and enolic acid. Other type of painkiller are opioids. These are the class of drugs which are found naturally in the opium poppy plant. These can be prescription medication and are often referred to as a painkiller, or they can also be called street drugs, such as heroin when taken for the long period of time and can prove to be addictive. Many prescription opioids are used to block the pain signals between the brain and body and are prescribed to treat moderate to severe pain. In addition to control the pain, opioids can also make the people feel relaxed, happy, and high. It means that these can be addictive. Three major classes of opioids are prescription opioids such as oxycontin and Vicodin. Second type is fentanyl, which is a synthetic form of opioid and 50 to 100 times more stronger than morphine. And third type is heroin, a drug which is illegal and is addictive. Third type of painkiller are the paracetamol, which are most widely used form of painkiller. Paracetamol is an international name of this painkiller which is used in Europe, and in USA it is known as acetaminophen. These names are derived from the chemical name which is an acetyl para-aminophenol. There is a long history behind the discovery of paracetamol. This drug was discovered by chance. We can also say that paracetamol is an accidental discovery. In 19th century, two doctors in the University of Strasbourg, in order to eradicate and kill worm by mistake, dispensed the acetanilide to patients instead of naphthalene. They noticed that the drug has small impact on the intestinal parasites, however, it decreased the high temperature. Then the other two scientists, Arnold Chan and Paul Hippa, published their discovery, and acetanilide was introduced in the medical practice for very first time under the name of antifebrin. With the passage of time, different scientists came and contributed in the discovery of paracetamol, and it became popular in 1948 when the scientist Bernard Brody demonstrated that paracetamol was active metabolite of acetanilide and is responsible for analgesic and antipyretic actions. These are formed by the reaction between the aminophenols and acetic anhydride. As a result, the production of acetaminophen and acetic acid will occur. These are most widely used form of painkillers and are common ingredient in the medicine that can be used for treating cold and flu. It treats mild to moderate pain such as headache, arthritis, tooth pain. Usual dosage of paracetamol is 1 or 2 tablets of 500 milligram at a time for adults, and it takes approximately an hour to work. These drug metabolizes in the liver, so it is very important to consult the doctor that whether it is safe to take paracetamol if you have liver disease or history of alcoholism. It is recommended to not take a paracetamol with any other medicine containing paracetamol, such as sometimes the combination of paracetamol is used with the ibuprofen, so it is recommended to not to take any form of paracetamol because of the risk of overdosing on it, so it can damage the liver and can be fatal. Now we will discuss the mechanism of action of different painkillers. The mechanism of action of NSAIDs is that these drugs work by blocking the COX enzyme. COX enzymes are also called cyclooxygenase enzyme, and NSAIDs will inhibit the cyclooxygenase enzyme and will result in the decreased production of prostaglandin. And as a result, the prostaglandin will produce anti-inflammatory, anti-analgesic effect. Based on the selectivity of cyclooxygenase enzymes, they can be classified into three different categories: selective COX-1 inhibitors, selective COX-2 inhibitors, and non-selective COX inhibitors. Not all NSAIDs work exactly, some work in different ways. As discussed earlier, they work by blocking cyclooxygenase enzyme. These enzymes are basically used to convert the arachidonic acid into thromboxane, which is a substance produced by the platelets and lead to the occlusion of blood vessels by fueling blood clot inside the vascular system. This has been implicated in many cardiovascular conditions and range from heart attack to stroke. Arachidonic acid can also be converted into the prostaglandin. As discussed earlier, these chemicals detect the pain and are the group of lipids that are made at the site of tissue damage and are also involved in dealing with the injury and illness. Arachidonic acid can also be converted into prostacyclin, which are the member of prostaglandin family. It serves as the vasodilator and inhibitor of platelet aggression. The therapeutic effect or beneficial health effect of NSAIDs are attributed due to the lack of eicosanoids. Eicosanoids are the metabolites of arachidonic acid. There are two types of cyclooxygenase enzyme, type 1 and type 2. Type 1 is present everywhere in the body and almost every time and play an important role in the health of gastrointestinal mucosa lining, kidney function, and platelet aggregation. Whereas cyclooxygenase enzyme type 2 is not present throughout the body, it is present in brain and kidney and is expressed during the inflammatory response. Most of the NSAIDs are non-selective. It means that they will inhibit both type of enzyme, cyclooxygenase type 1 and cyclooxygenase type 2. Cyclooxygenase type 2 selective NSAIDs will target only cyclooxygenase type 2 enzyme and provide the anti-inflammatory relief without compromising the health of gastrointestinal mucosa. For better understanding of the mechanism of action and of NSAIDs, we will discuss a flowsheet diagram. In first step, Phospholipids, which are present or main constituent of the cell membrane, are converted into the arachidonic acid in the presence of enzyme phospholipases. In the second step, arachidonic acid are converted into prostaglandin in the presence of cyclooxygenase enzymes. All conventional NSAIDs inhibit the conversion of arachidonic acids to the prostaglandin. This is catalyzed by the prostaglandin hydrogen synthase. But at present, these enzymes are also referred as cyclooxygenase enzyme. Prostaglandin hydrogen synthase is a bifunctional and possesses two different type of enzymatic action at the site cyclooxygenase and peroxidase. The mechanism will take place in the two steps. In first step, the conversion of arachidonic acid into the prostaglandin synthase will occur, which involve the cyclization of arachidonic acid into the unstable hydroxyperoxide. And in the second step, reduction of hydroxyperoxide will take place into hydroxy analogs, which is an unstable structure. Prostaglandin synthase is a substrate for the specific synthesis, tissue-dependent isomerases, and catalyze its further conversion to different types of endogenous regulators, which are prostaglandin H, prostaglandin D, prostaglandin E, and thromboxane A. These endogenous regulators are characterized by the different biological activities, and many of them show the anti-inflammatory properties. This was the mechanism of action of NSAIDs. Now we will discuss mechanism of action of paracetamol. I'm not exactly sure that how paracetamol works, but it is thought that it also works by blocking the cyclooxygenase enzyme in the brain and spinal cord. These drugs are used to treat the mild pain and also used in the case of fever. However, like NSAIDs, which help in the inflammation, these drugs cannot be used for inflammation. The primary site of action of paracetamol is the inhibition of prostaglandin synthesis or the active metabolite, which is influencing the cannabinoid receptors. Prostaglandin hydrogen synthase metabolizes the arachidonic acid into its unstable form. There are two types of prostaglandin hydrogen synthase enzyme, type 1 and type 2. This prostaglandin hydrogen synthase enzyme will work at two sites, cyclooxygenase and peroxidase. At cyclooxygenase site, it will be converted from arachidonic acid into PGG type 2, which depends upon the tyrosine 385. And at the peroxidase site, the formation of phenyl protoporphyrin will occur. It is formed from the Fe plus 3 and is essential for the conversion of tyrosine 385 to its radical form. So paracetamol acts as a reducing co-substrate on the peroxidase side and decrease the availability of phenyl protoporphyrin. This effect can be reduced by the lipooxygenase enzyme within the cell, and it is also called, this phenomena is also called peroxytone, which further explain the lack of peripheral analgesic effect, platelet effect, and anti-inflammatory effect by the paracetamol. Effects of paracetamol can be moderated by para-aminophenol, which is conjugated with arachidonic acid by amide hydrolase to form AM404. It will exert the effect through the cannabinoid receptors working in the area of pain and function on the concentration of fatty acids. Flowsheet diagram for the mechanism of action of paracetamol will show that it works by inhibiting the synthesis of cyclooxygenase enzyme in the central nervous system, but it will have no peripheral action or anti-inflammatory action, as a result of which prostaglandin will be no longer synthesized. Cell membrane is made up of phospholipids, and as soon as the injury occurs, phospholipase enzyme is present in the tissues and will become active. As a result, it will be released immediately and break down the phospholipids in the cell membrane into the arachidonic acids. The arachidonic acid in the presence of cyclooxygenase enzyme will be converted into the prostaglandin and thromboxane. Prostaglandin are the chemicals which help to feel the pain, fever, and inflammation. So the paracetamol will inhibit the synthesis of prostaglandin, and as a result, we will not feel pain, inflammation, or fever. So the mechanism of action of paracetamol is that it will block the cyclooxygenase, and as a result, arachidonic acid will no longer be converted into the prostaglandin. And when prostaglandin is not synthesized, we cannot feel pain, fever, and inflammation, and patient will feel relief. Mechanism of action of third type of painkillers, opioid, is that they work by binding to the specific receptors which are called opioid receptors. Opioid receptors are mu, GABA, and delta. When this happens, opioid will block the pain messages which are sent from the body through the spinal cord toward the brain. As a result, it will decrease our sensation to feel the pain, or we can say that it increase our tolerance for the pain. When opioids are used for the long period of time to relieve the chronic pain, they can be addictive. Flowsheet diagram for the explanation of opioid. As we can see that there is a presynaptic neuron or nervous system on the top and postsynaptic neuron in the bottom. Neurotransmitters will be released from the presynaptic vesicles, which is also called N terminal. After crossing the synapse, they will enter the postsynaptic nerve and will bind with the receptors that are present in the postsynaptic nerves, resulting in the formation of complex. Opioids will show the activity when complex is formed. So first step is the synthesis of neurotransmitter. Generally, excitatory or inhibitory neurotransmitters are present, but in the presynaptic nerve, or in the case of analgesic, we can say that neurotransmitter will contain GABA 5-HT. These neurotransmitters are stored in the vesicles and will be released when the cations from the calcium channels, which are present in the presynaptic neuron, will enter inside the cell. As a result, depolarization will occur. Calcium channels cause the calcium ion to move from the extracellular to the intracellular environment. So the calcium ions or positive charge will increase inside the cell. And the entry of positive charge will release the neurotransmitter from the presynaptic vesicles towards the synapse, After it will move towards the postsynaptic respective receptors. And on binding with the receptors, they will give their action. As we know that a neurotransmitter release gives the perception of pain. In other words, we can also say that synthesis of neurotransmitter occurs when the sharp object come in contact with our skin. And our objective of using opioid painkiller is to block this perception of pain and eradicate the discomfort. When we take opioid analgesic, it will work on the opioid receptors. There are three types of opioid receptors: mu, GABA, and delta. The first target of opioid analgesic is to inhibit the calcium channels present outside the presynaptic neurons. The inhibition of calcium channels will minimize the entry of calcium through these channels because the entry of calcium was increasing and positive charge was also increasing in the cell. As a result, depolarization was occurring. So opioids will reduce the depolarization and minimize the action potential. And as a result, perception of pain will be reduced. Opioid receptors are also present in the postsynaptic membrane, which have potassium channels. These channels are responsible for the movement of intracellular potassium towards the outside environment, and positivity will decrease inside the cell. We can also say that negativity will increase inside the cell, and as a result of which hyperpolarization will occur. When hyperpolarization will occur, action potential will be inhibited, and as soon as the potassium ions move out of the cell, perception of pain will be vanished and we will feel relaxed. So these were the different mechanism of action of painkillers that can be used to treat pain, depending upon the type of pain. Migraine is one of the most common form of headache, which is caused by the dilation and inflammation of arteries such as cephalic arteries and intracranial extracerebral arteries. Symptoms of migraine arises from the activation of sympathetic nervous system, which is caused by the pain. So there are different medications that can be used to treat migraine depending upon the intensity of pain. But if these painkillers are used too often, this can also cause headache themselves. Following are the medications that can be used to treat a migraine. We can take Nsaids or paracetamol, antiemetics, and triptan and ergotamines to treat the migraine. First type of drug is Nsaids. These are the painkillers which are very effective to relieve the migraine pain and are most effective form of painkiller used in the Germany. Research shows that these drugs are really effective in treating migraine. Without a painkiller, migraine might disappear within 2 hours in about 10 out of 100 people. But when painkillers are used, it is dispersed within same period of time in about 20 out of 100 people. In other words, we can say that pain was gone in extra 10 out of 100 people 2 hours after taking the medicine. And another 20 out of 100 people expect some pain relief. The effectiveness of drug depend upon things like severity of migraine and dose level. Side effect of painkiller that are used in the treatment of migraine. The side effects are rare because They are used for the short span of time. Ibuprofen, which is an NSAID, may cause stomach pain in less than 1 out of 100 people. NSAIDs, which affect the stomach lining, are not suitable for the people who have stomach ulcers. So, the high dosage of NSAID can increase the complication in people with heart diseases. Intake of acetyl salicylic acid for migraine can reduce the blood's ability to clot and increase the risk of bleeding. Bleeding is very slight, such as nose bleeding or bleeding of gums, but in rare cases it can be more serious, such as bleeding in case of gastrointestinal tract. Acetaminophen is also not suitable for the people who have poor liver functioning because it is metabolized in the liver, and high dosage of paracetamol can even cause liver damage in the people who are healthy. The next type of painkiller that can be used to treat migraine are triptans. These are specific painkillers for the migraine that help to relieve pain and reduce nausea and sensitivity to light. These painkillers act to narrow the blood vessels in the brain and inhibit the release of chemical messengers that contribute towards the inflammation. Types of triptans are almotriptan, alitriptan, flavotriptan, naratriptan, rizatriptan, sumatriptan, and zolmitriptan. These are the different types of triptans that are being used in Germany and can be used in different ways. Some of these drugs can be used in the form of tablet, capsule, nasal spray, suppositories, injection, lozenges, which are placed under the tongue. But most of the triptans are prescription only, which means that need to be subscribed. They need to be prescribed by the doctors. But almotriptan and naratriptan are available even without the prescription. Because of the chemical differences between the triptans, they're sometimes taken in different dosage. Triptans also differ in the term of their duration of action, so some of them may start working more quickly and have shorter effects. This means that if one triptan doesn't prove to be effective or do not provide the relief, it might be worth trying the other one. All triptans can help to relieve the migraine, but most commonly prescribed triptan is sumatriptan with dose level of 50 mg. Without sumatriptan, migraine might went away within the 2 hours in about 10 out of 100 people, but with sumatriptan, the pain disappeared at the same time in 20 to 30 people out of 100. So additional 10 to 20 out of 100 people had no pain 2 hours later, and drug offered at least some pain relief in other 25 out of 100 people. Effectiveness of drug depends upon the severity of migraine and dose of drug, how it is administered. For example, injections are faster and more effective than other form of administrations. Triptans are unsuitable for the people with cardiovascular diseases because it can narrow blood vessel and increase the pressure of blood. The possible side effect of triptans are drowsiness, unusual sensations such as tingling, weakness, heat or cold, and sometimes mild nausea as well. Ergotamines are another form of painkiller that can use to relieve migraine. As the name indicates that these are made from fungus called ergot. For nearly 1 century in ancient times, it was only the migraine specific drugs, but ergotamines are not used nowadays because they have more side effect as compared to triptans. Migraine is basically caused by the dilation and inflammation of cephalic arteries and intracranial extracerebral arteries. And it is caused by the neurophysiological phenomena of excitation or depression. There are different mechanisms that contributes in the migraine attack. So to reduce it, we can take different anti-migraine medications. The two major type of anti-migraine medications are abortive and preventive. Abortive anti-migraine work to stop migraine attack as it is happening. These medications act by constricting the dilated arteries through the stimulation of serotonin 1B receptors, whereas the preventive anti-migraine prevent the additional migraine attacks and acts by increasing the tone of extracranial arteries, inhibiting the mechanism of neurogenic inflammation, or inhibiting the pain transmission within the central nervous system. Another form of pain which is most common in people in old ages is arthritis. It is the swelling of joints. Symptoms of arthritis are joint pain, stiffness, and it becomes worse with the age. Two major types of arthritis are osteoarthritis and rheumatoid arthritis. Osteoarthritis is the most common form of arthritis. Some people also call it degenerative joint disease or wear and tear arthritis. It is most commonly occurring in the hand, hips, and knees. Cartilage with joint begin to break and underlying bone will change in arthritis. In rheumatoid arthritis, it is autoimmune and inflammatory disease. It means that your immune system will attack the healthy cells in the body by mistake, and as a result, inflammation will occur in the affected parts of body. Rheumatoid arthritis attack joint and usually many joints at one time. Many people with arthritis use the supplements such as glucosamine or chondroitin for the treatment of this disease. To treat moderate to severe arthritis need pain, the combination of these two supplements, glucosamine and chondroitin, is taken, which might ease the pain, although the medical studies have not shown the clear proof that they help. The medications that are used for arthritis are prescription NSAIDs. These are stronger than over-the-counter drugs that are used to treat the arthritis, pain, and inflammation. Like over-the-counter NSAID, if these medicines are taken for a long period of time, it can cause heart attack, stroke, and kidney disease. Some NSAIDs such as diclofenac cream work well for the hand and knee arthritis and have less chances of side effect than the pill we swallow. We can also take prescription opioids to treat arthritis. In special cases, strong pain killers such as codeine, hydrocodone, or oxycodone are used to treat arthritis pain. But these drugs need to be taken carefully because if they are taken for a long period of time, it can cause serious side effects such as nausea, constipation, and dizziness. So, due to these side effects, doctor prescribe these medications to only those patients which are suffering from the severe pain and cannot take NSAIDs, or for those who are waiting for the joint replacement. Third type of medication that can be used to treat arthritis are steroid medications. Steroid medication ease the pain by lowering the inflammation, but these drugs help for only short period of time. Side effect of these drugs are infection, bleeding, allergic reaction, discoloration, and rupture of tendons when they are administered in the form of injections. The benefit of corticosteroid is that they act very quickly. Shots of hyaluronic acid can also be used to treat arthritis, but they cannot be used for the people with skin or joint infection. Example of hyaluronic injections are Euflexa, Hyalgan, and Orthovisc. The use of antidepressant medicine is also used to treat the chronic arthritis pain, even if you don't have depression. One antidepressant that is most commonly used is duloxetine. It is an FDA approved and used for the treatment of chronic musculoskeletal pain. Tricyclic antidepressants can also be used for the chronic pain. These are most often taken near the bedtime because they can make you sleepy. Side effects of using antidepressant are dry mouth, nausea, weight gain, and constipation. Use of the antidepressant have higher risk of suicidal thinking and behavior in children and adults. So anyone starting antidepressant should be monitored closely. Painkillers prescribed. The type of painkiller which is prescribed by the doctor depends upon the type of pain, intensity of pain, side effects of these medicine, and how, and doctor also keep in view the other health problems that you might have. So these are the four conditions which are kept in mind while prescribing a medicine. Paracetamol is normally prescribed if pain is not too serious. In the case of mild pain and fever, the major difference between the paracetamol and Nsaid is that Nsaids can be used for the inflammation, but these are no, paracetamol or acetaminophen are not effective for the inflammation. Nsaids are generally prescribed for the people who have pain and inflammation, for example, pain in joints or muscle. But these have possible side effects and are not suitable for everyone. For example, the people with stomach ulcer cannot use Nsaid. So in this case, the doctor prescribe a safer medicine such as paracetamol, even though it might not work. Opioids, which are classified into two classes, weak and stronger opioids. Weak opioids are also prescribed for severe pain. For example, if you have tried paracetamol or NSAID and it is not effective, then we can take weak opioids. But stronger opioids are used to treat very severe pains. For example, it is used for the treatment of cancer-related pains or pain that occur after an operation. Different painkillers can be used in different forms. People who are in pain are usually recommended to take the painkiller regularly. For example, if you have prescribed paracetamol, you will take it normally 3 times or 4 times of times a day, depending upon the intensity of pain, until you start feeling better. If you are taking NSAID such as ibuprofen or diclofenac, you will take it after the food. This is because if these drugs are taken in empty stomach, it can irritate the lining of your stomach and sometimes cause bleeding in it. Side effect of painkiller, they are Side effects of painkiller are very rare because they are used for the short period of time, but side effect may occur in the case of overdosing or if taken for the long period of time. First, we will discuss the side effect of NSAIDs. When these are taken properly, they have many beneficial health effects, but many people use these NSAIDs for all kind of painful conditions. So, serious side effect may occur such as bleeding into stomach and gut and cardiovascular problems. Paracetamol is very safe painkiller and its side effects are rare unless or until it, we take overdose of it. Overdose of paracetamol can happen by mistake, but sometimes people may consume it intentionally. The main problem while taking the overdose of paracetamol is that it can damage your liver permanently and you can die from it. Side effect of opioids. The most common side effects are nausea, vomiting at the start of treatment when we start using opioids. The other side effects are constipation, dryness of mouth. It can also cause drowsiness and confusion. Some people can become tolerant to the opioid painkiller and become dependent on it. So if you think that you are depending on opioid, you need to take higher dosage of it, you must consider or discuss it with your doctor.